Hello, my name is Annabelle, and this is my presentation discussing the role of teamwork using the PPD framework for MEDI 6200. In my first semester of medicine at Notre Dame, I had an extremely challenging experience during PBL and CD, as the groups are the same at that point during the year. Our group was very diverse in terms of personalities, learning styles, and even political views. In CD especially, there were moments when students expressed opinions that were really confronting, including racism and anti-abortion comments, things that deeply challenged my own views and values. I found this especially difficult to sit with, considering we are training to be healthcare professionals as well. Some students also refused to participate or were openly dismissive of group learning, and at times even rude to peers and staff. As someone who's naturally outgoing and comfortable taking lead and initiative, I felt responsible for trying to hold the group together. Our PBL tutor even asked me and another student to help manage the group because it became so dysfunctional that she needed assistance from us. In the end, that responsibility left me feeling completely frustrated, emotionally drained, and honestly burnt out by the end of semester 1. I was so overwhelmed, trying to keep the peace, push the group forward, and maintain my own study load at the same time. I felt trapped between wanting to be a good team leader and team member, but also realising that no matter how hard I tried, I couldn't fix the group alone. I started to dread the PBL and CD sessions and lost focus on what was important, which was my own study and preparation for my mid-semester exams. Yes, PBL and CD are foundational to our study, but putting in so much effort to manage group dynamics at this point was hindering my academic progress. I entered semester 1 exams completely anxious and overwhelmed and ended up nearly failing. This experience reminded me of a similar group task in my undergraduate degree, where we had to design a diabetes infographic. It was about a group of 5 of us. One of the group members didn't contribute at all, which created a lot of frustration and extra work. We reached out to them several times, but eventually had to escalate the situation to our professor. Looking back, that situation also taught me that it's not always possible to carry the group alone, and that setting boundaries and asking for help are important parts of working in a team. Since that first PBL and CD, I've come to understand that what we experienced as a group aligns with what Tuckman describes as the storming stage of group development, where unresolved conflict can derail productivity. I think we got completely stuck there. We never reached the norming or performing stages because we didn't have shared goals, and the psychological safety in the group was extremely low. A scoping review by Blankley and colleagues on interprofessional bedside rounds explored the role of teamwork in patient care planning. Even in professional settings, poor communication and unclear roles can lead to conflict, stress, and poor outcomes, and my experience in PBL and CD definitely exemplified this process. The paper also highlighted that even well-meaning teams can fail without structure or support. This made me feel less alone in my experience. It wasn't just me, it was an overall lack of structure and support within the team. Edmondson's research on psychological safety also helped me understand that people are less likely to speak up or contribute in groups where they don't feel respected or heard. This is exactly what I experienced. It reinforced the idea that leadership isn't just about taking charge, but also about creating a space where people feel safe enough to contribute. This experience made it clear to me that I need to speak up earlier when things aren't working, especially when it's beyond my responsibilities as a student. I ended up contacting Effie and Paul at the end of the semester, but by that point it was too late to really change anything. I wish I had reached out sooner and protected my own well-being before it progressed to burnout. Moving forward, I want to build skills in conflict resolution and assertive communication, and most definitely boundary setting. And I'd like to learn more about structured tools such as Team Steps and SBAR. These frameworks help healthcare teams manage complex communication and shared responsibilities, which I believe we are learning the building blocks of in our PBL and CD groups in Year 1s and Year 2s at Notre Dame. This experience was a huge learning curve for me in terms of teamwork. I used to believe being a good member of a team meant stepping up and doing more than everyone else, but I now realise that good leadership also means knowing when to step back, when to speak up, and also, and probably most importantly, ask for help. I've learned that maintaining my own well-being is not selfish. It's an essential part of being a good contributing team member. Since that first semester, I still take an active role in every PBL, but I've set better boundaries. I engage fully, but I trust the tutor to manage any group dysfunction. And if I see that things are maybe escalating beyond a level that I can't control, I know to escalate it to my year coordinator, which in our situation would be Annie. My focus now is on contributing equally. I feel more confident in my identity as a medical student and as a future healthcare professional who can lead, but also recognise limits and advocate for support when it's needed. Please see my references below.